Hello.
Hi.
How are you?
I'm fine.
Good, good, good. Bridget, yeah. See, uh, I really want to talk to you about healthcare. You know, my personal uh story, and there's so many public health issue going around in our community, and it's important for us to talk about these things because uh, I think many of us don't understand what public health is. So I want to talk about your work and other things around your work. Okay. So help me uh, introduce yourself to my audience and tell them who you are and what you do.
Yeah, thanks, Ekene, for the opportunity. So basically, Dr. Bridget Nwagbara. I'm a medical doctor who believes in keeping hearts beating forever. And to do that, I have to wear three fundamental caps. So,
Okay.
one as a medical health practitioner who sees patients, and then the second one as a public health specialist who has the capacity to influence both policy and community level practices.
Yeah.
And then finally, as a researcher who has to collect data and you make sure that this data informs the practice decisions that people take in the hospitals and also policy making, and if possible also the decisions people take in their homes. So basically, that's how I like to describe myself.
Okay, that's very good. See, as a researcher, that means you are one of the uh, less than 5% of doctors who are actually scientists.
Oh,
Because people generally think doctors are scientists. Okay, and I tell people no, not very few doctors actually scientists. You do research. That's good. That's good. So
yeah, but I can clarify that. So every doctor is a scientist because the we have to make scientific decisions.
yeah, okay.
So there's a way, if you look at science from the angle of not just research, but if
Yes.
you look
Okay.
at putting the research findings into practice,
Okay.
that's one
Yes.
big part that people forget. And that's where it often gets modeled,
Hmm.
So
Well,
as we talk later,
let me ask you.
I can give you instances.
Let me ask you.
Mhm.
Is every computer engineer a scientist?
Well,
They are not. They use the knowledge from science to
yes.
that, and that's
So,
exactly what doctors do.
so the thing is, for the medical health profession is
Mm.
not that differentiated.
Okay.
So every day in the life of a doctor, you will have to, when you see a doctor who is seeing patients,
Yeah.
so after seeing patients, then they have to get back and then review. You see, so
Yeah.
that's where the research comes. So every doctor has to review their caseload for
Okay.
all their patients
Okay.
and then begin to draw
Maybe I don't
inferences.
know.
Yeah, so that's where, so that's what I'm saying, that if you look at it from that's dedicated,
Yeah.
like dedicated researchers. Yes, there are
Yeah.
doctors
Yeah.
who are dedicated researchers.
Researchers. Yes.
Yes, and then
Those are the
yeah,
ones I consider as
no,
scientists.
no, every doctor has to do research.
After doing the practice, they do the research, they do data collection,
Oh yeah,
analysis.
no,
Yeah.
not everyone, but all of them have to do that for their practice. So
Okay. All right. All right.
if you see 50 cases, then you have to um, make sure that the 50 clients,
Mm.
you review them, they're human beings. So you have
Yeah.
to review how all their various biomarkers and their function,
Yeah.
is adding up to
Mm.
be able to help inform your next decision when they come back.
Okay.
And probably by then they've gathered more data. So that's why in the life of a doctor, you see a doctor going from practice when they're by the, on the desk seeing clients, by the patient's bedside,
Yeah.
patient, clients as well. And then when they are doing the reviews in the offices, and then also sometimes when they are being called on to make some practice decisions, like they say, okay, we're closing the clinic on XX day because XX day there are not many people who come in, so we can as well just keep a few people while the others come. So those kind of decisions have to be evidence informed. That is data informed. Yeah.
Okay. Very good. Very good.